Okay, I'm gonna get started. Dr. Mary with the Remedy Room. Today I'm talking about the Boston Heart Lab or Boston Heart Diagnostics test that we took at Lab Camp. And aside from the mold lecture, this was my other favorite lecture. They had some great slides and some really good visuals and information. So I'm gonna start off with just reminding you that 50% of the people who have a heart attack who show up in the ER have normal cholesterol. Now, the bulk of us are put on statin drugs very quickly. When I was in training, the treatment for high cholesterol was diet and exercise. The second treatment, diet and exercise, and the third, diet and exercise. Currently, that is not happening. Immediately when someone's cholesterol is elevated, the doctor immediately puts them on statins. And the problem, this is not a statin discussion, but the problem with that is we're missing 50% of what's going on. If half of us are having heart attacks, whether we're on the statin or not, then we need to look a little further at what is happening and why is heart disease so prevalent. And did you know that 3/4, that's 75% of diabetics don't die from diabetes, they die from heart attack and stroke. So we need to figure out what's going wrong, and what's going wrong is it's a level of inflammation. So the beauty of this Boston Heart test is that instead of just getting the total cholesterol, the triglycerides, the LDL, the HDL, and the VLDL, which is sort of the standard test that we've been doing for the past 20 years, which doesn't really give us a lot of deeper information. These guys do greater testing and more specific testing. One of the inflammatory markers that they check, and we do always, is a CRP. There's a high sensitive CRP that stands for C-reactive protein. So this is a protein that's elevated with inflammation, with infection, and a really great marker to see what's going on a global scale. The next test that they do is called the LPPLA2, and this test checks for how high a risk you are for any plaques to rupture, which is what we're really at risk for, is not just a rupture of the plaque. A lot of times people think that when I have high cholesterol, it just gets so much that the whole vessel wall is occluded. And that does happen. But a large majority of the time, it's when the plaque ruptures, when it breaks off, almost think of like a scab peeling off, that a clot develops, and it's the clot that causes the problems. So the final test, let's see, there's one other that I really would like to talk about, and it's lipoprotein little a. So getting this baseline cholesterol and looking at your labs and feeling like, oh, I'm good, is not the full picture of what's going on. As we mentioned, if half of us can still have heart attacks with normal cholesterol, then what do we do? So there's something called lipoprotein little a. This is a very dangerous marker if it's high, over 50 for sure, and over 15 and under is the goal. If it's over 50, you are 2 times the risk for having a heart attack or stroke. So here's where my issue or problem is. We are very good at prescribing statins for everyone with high cholesterol, but what we don't realize is that statins may increase the level of lipoprotein little a, which puts us at much higher risk to have heart attack and stroke. So it's a test that I think all of us should be getting. But again, back to the inflammation. Let's look at the root cause. Let's try to figure out the why. Because remember, cholesterol is there to help patch up any damage to the vessel wall. And so we need to look for the why. Well, in our clinic and all over the integrative world, we're looking at what is causing the inflammation. Is it malnutrition? Does the person have low vitamin C levels and low lysine and inability to create a very strong endothelial wall? Is it because our sugar is too high? Look at this picture, how awesome. And it says to think about sugar, I would say like shards of glass, damaging the artery wall, scraping the wall, and then the cholesterol goes in to patch and heal the vessel wall. So if we take away all the cholesterol, like yesterday I got a lab review from a patient who was very excited. His doctors are ecstatic because the LDL was 7. He has no way to repair these vessel walls, and I don't think that's necessarily the direction we should go. Taking away all the cholesterol, first of all, 75% is made in the liver. So if we take it away, we're gonna produce more. 25% is based off what we eat. So let's get into what we eat. If sugar is causing the inflammation, is what's damaging the vessel wall, and diabetics are at the highest risk, and the majority of us have either pre-diabetes and don't know it, or we have diabetes and we know it and we're not able to get our sugar down, then that is the conversation I think we need to be having on how do we help you reduce this oxidative damage. And think oxidation is rusting. So we're rusting and damaging the inside of our walls. An antioxidant would be something that would reduce the rusting, hence the things that we use in our clinic. And the other things to look for would be inflammation in the mouth, looking for any insidious infections because of the bacteria that travel from the mouth and get into the bloodstream, getting in hormonal balance. Having low thyroid function or hypothyroidism greatly contributes to elevated cholesterol. So does abnormal sex hormones. So low testosterone is actually correlates with elevated cholesterol, and guess what? We need the cholesterol to make testosterone. So it's actually this feedback loop and a merry-go-round. So are we creating a lot of people, are we making a lot of people have low testosterone because we have such a rampant use of statins? So I think the body is so brilliant, and I can't understand why God or whoever you believe in would make something that would harm us in the fashion that we think. I feel like we're going down a rabbit hole that is really not the answer. So our goal is to teach you about inflammation. What can you do to reduce your risk? The things that we talk about in our visits would be looking at a coronary artery calcium score, but that's only going to tell you the plaques that have calcified. What about the soft plaques? So we recommend patients sometimes get a carotid intima media thickness. That's an ultrasound looking at the carotids, because if you have plaque here, the likelihood is you probably have plaque in the heart vessels, but you'll be at higher risk for stroke if we see something here. And then what to do about it, it's the same things that we've discussed numerous times: reducing stress, exercising, getting good sleep, removing the toxins. So let's just remember, sugar in the wrong spots or elevated too high, scraping the vessel wall. It's just such a great visual. But removing the sugar, the excess sugar from our diet, is someplace where you can have a massive impact. Remember, we've talked about fasting and reducing our triglycerides, which is really, it's a fat, but it's a storage form of sugar. So Dr. Miri with the Remedy Room. Hopefully this is giving you some new information to read about lipoprotein a. That's the one I want you to investigate. And it's never just one thing. So it's not just the cholesterol, and I feel like we've put all our eggs in that basket, and we have to look at so much more. And there's so much more that we can do to be in charge of our health. So if you have any questions, just email us at info@theremedyroom, and thank you for watching.